Hello, my name is Jordan Egger, and this is my capstone part 4 project. I am doing my project on mental health problems in children in foster care. Alright, I'm going to tell you a little bit about children in the foster care system who have a mental health illness. Mental health problems in children in foster care has become an extreme issue throughout the world, especially in America. Up to 80% of children in the foster care system have a significant mental health issue, compared to approximately 18 to 22% of the general population. As a result to these issues, mental health is increasing in the foster care system. The American Academy of Pediatrics and also the American Health Foster Care Initiative has identified mental and behavioral health issues as the greatest unmet health need for children and teens in foster care. Mental and behavioral health in children factors a history of complex trauma, frequently changing situations and transitions, broken family relationships such as abuse, drug addiction, or just being separated as a whole, inadequate access to services and medications due to their health and their money and insurance. A brief literature review of children in the foster care system who have a mental illness. Children in foster care have significant developmental, behavioral, and emotional problems. The children who were formerly in foster care have a high emotional and behavioral disorder rate. The concern is the lack of mental health screening for all children entering out-of-home care and the access of high-quality mental health services. Most children in foster care have a traumatic family history and life experiences that result in an increased risk for mental health disorders. When a child gets out of foster care, if they have a mental health illness and they do not get treatment, the mental illness will progress. No matter how old they get, the older they get, the faster the illness progresses. The prevalence of both mental and physical health concerns among children who are in foster care is increasing drastically. Less people who know about behavioral and mental health needs of children in foster care who have mental illnesses. The population as a whole needs to adapt to these issues of children with mental health problems, especially if they are in the foster system. The more people know, the better, because they can help get the children that do have those mental illnesses get treatment and the medicine that they need. Now I'm going to tell you why I chose this method and why it is so important to me. It is common for children in the foster care system to have a medical or some type of health problem. The problem is, if we acknowledge and help them with their illnesses, they will get the treatment. There are many problems when it comes to caregivers giving treatment and taking care of the children under their care with a medical problem. Most of the time, I feel they don't get the care that they need or deserve because they can't afford it. Money is a big issue to a lot of people, and if you do not have insurance, then it is harder for them to afford the medicine that they need in order to get healthy. They need medicine and treatment depending on how severe the illness is. The more severe the illness is, the more expensive it's going to treat. We need more people that care and will spend the extra time and money on children who have the excessive illness. Also, we need to spread the word, so to speak, about children in foster care in general. No matter if the child has an illness or not, I feel that every day children are being neglected. There are many reasons why children are still in foster care, either because of their age. Age is a very big factor because if you are past an age limit around, if you're in middle school or in high school, a lot of people don't want to adopt them because they want someone that is younger and they can grow up with and adapt to them. Their ethnicity is another problem. A lot of people who want to adopt want the same ethnicity. So if you are a Caucasian, you want a child that is the same race. Because if a lot of people can be very judgmental. So if you are Caucasian or if you are African American and you decide to adopt someone that is Asian or Japanese, a lot of people will question your family, and that is not how it should work. And lastly, because of their health. The health is another big factor because one, they have to pull their savings out and they don't want to take the time to take care of a child when they can get a healthy one. A child's health is the most important quality, and if a child was abandoned since they were an infant, who had abusive or neglectful parents, or even addictive parents. Most of the time, people who are looking for a child, they want a healthy baby that will be taken care of easily and they don't have to spend a lot of money on for those types of problems. Now, why this is important to me is I believe that people choose to do topics like these can connect more if they have a history in some type of area, whether it is CPS, child abuse, foster care. It all kind of relates, in my opinion. And since I have experience in one part or another, that I feel like this is a main issue that needs to be um, helped and needs to be at the top of everybody's list. Children in foster care are extremely vulnerable. The reason why they are vulnerable is because they're young, they're in an unknown place, they don't know who they are around, and it's very scary for them. And we need to take that into account. And there are multiple levels of emotional, social, and behavioral needs that children need to have. Research indicates that foster care has a significant developmental, behavioral, and emotional challenges. There are multiple studies that indicate children in foster care settings have a higher rate of mental health diagnosis compared to children not in the foster care system. According to the Human Services and Department of Health, children with a mental illness need to meet certain requirements in order to get the full effect of their attention to that illness that they have and the full like medicine, treatment, all of that. You need to have certain requirements to meet those standards. They look at your family history, the parents' backgrounds, your background, what kind of illnesses are passed down through the generations, etc. My findings on children in the foster care who have mental health problems is children in the foster care suffer from an extreme high prevalence of mental health problems, yet it remains unclear if they are consistent in their use of mental health treatment such as therapy, mental health problems such as anxiety, depression, and problems with behavior and interpersonal relationships can be devastating to children. Because they have pre-existing emotional problems and the trauma of removal from their home, most children may not have an immediate need for treatment upon entering foster care. If you change a child who has a mental health issue and you change their surroundings, they will not want to interact and get treatment or talk to anybody, and it's just the stress, and that their mind shuts down and their body shuts down because you are taking away what they are so accustomed to. Now, some studies that I found and evidence suggest that children in foster care receive mental health treatment services at a higher rate than the general population, while other studies and evidence indicates that their needs remain largely unmet. So it's kind of like an in-between situation right now. Half the findings that I am finding, there have been the studies that children are getting excessive treatment, and there are other studies that I'm finding where they aren't getting treatment and not even that they're oblivious to the situation that they have an illness is to that fact. To continue on from my analysis, each year over 1% of children in the United States spend time in foster care, with 6% of children in the United States placed in foster care at least once between their birth and their 18th birthday. Although we considered consequences of foster care placement for children's well-being, there have been no study used to represent United States children to compare the mental and physical health of these children placed in foster care to the health of children not placed in foster care. Children in foster care are in poor mental and physical health related to children in the general population, children across specific family types, and children in economically disadvantaged families. Nearly all differences in children's demographic characteristics plays a role in their current home environment. Children adopted from foster care compared to children in foster care have a significant higher odds of having some type of health problem. My concluding remarks on children in the foster care with mental health is that children placed in foster care can endure a number of disadvantages, both because of the maltreatment they have endured and other risk factors associated with their placement, including poverty, parental drug and alcohol abuse, neighborhood disadvantage, and epigenetics, which is a change in organisms caused by modifications of gene expression rather than genetic code itself. It is unsurprising that children in foster care experience more depression, anxiety, attention deficiency, ADHD, and behavioral problems. Children who have ever been in foster care also struggle in school, finding employment, and abuse drugs and alcohol in their adolescent and early adulthood. Data limitations to data have made it impossible to compare mental and physical health of children placed in foster care to the general population. Also, to compare mental and physical health of children in foster care to children across most family types or in economically disadvantaged families. Thousands of children are being separated from their parents and living long periods of time in the system because of mental illness, neglect, and abuse. Permanent foster placement is an alternative place to these children with an illness. We need to find a way for children to be out of the system faster and find good homes permanently. We need to find a more permanent placement for children to feel like they are loved and that they belong somewhere. Every child matters, if they have an illness or not. They are the same as every other child who has feelings and wants to be loved and have their own family and home. Thank you for listening and seeing my presentation. I hope you enjoy it. Thank you.